And so you create a pre-surgical treatment plan that these are the arterial feeders, and these are all the vessels that have been labeled so that basically we know which vessels to attack, and we know that basically the venous drainage, etc. So the surgical plan is to deal with the individual vessels to devascularize the AVM. And of course, this has been we have been able to resect all these large AVMs with this, and this is published in a series of 50 patients last year in May. We're moving on, and of course, the problem is that being having a virtual reality platform may mean that you only have a small group of people who can benefit from it. So we thought we'd try and build where we could have a big audience of 150 people, where we could look at this and of course plan it on a symposium base. This is a presentation that I made in the AANS in San Francisco about 3 years ago to an audience of 150, and this is Dr. Panetsky in one of our instructional courses on virtual reality, where we taught neurosurgical procedures and approaches to an audience of 100 in our hospital. So you can actually use a DEXA beam now on a screen and be able to see virtual reality images and present it to an audience. This is the virtual temporal bone module that we created for our skull-based surgeons. See all your cranial nerves, your inner ear apparatus, trying to simulate a surgical approach. This is a subtemporal approach. This is a translabyrinthine approach. So you could now simulate procedures, not only understanding anatomy, but be able to simulate the operation and plan an operation and deciding for yourself which is an approach that is better, whether it's a subtemporal or a translab approach. And this is the same AVM that we have had with a plan in virtual reality.